Question 1. A 35-year-old female presents with a painless lump in her breast. Physical examination reveals a mobile, well-circumscribed, rubbery mass that is not tender or fixed to the skin or chest wall. What is the most likely diagnosis? A. Fibroadenoma. B. Breast abscess. C. Invasive ductal carcinoma. D. Mastitis. Answer. A. Fibroadenoma. Explanation: the patient's clinical presentation of a painless lump in the breast that is mobile, well circumscribed, and rubbery, without tenderness or fixation to the skin or chest wall, is suggestive of a fibroadenoma. Fibroadenomas are common benign breast tumors, especially in young women. They do not require immediate intervention but should be monitored or may be excised if they cause concern or continue to grow. Question 2. A 65-year-old female presents with a history of chronic gastroesophageal reflux disease, GERD, and difficulty swallowing solid foods. An upper endoscopy reveals a stricture in the distal esophagus. What is the most appropriate management for this patient? A. PPI therapy and lifestyle modifications. B. Esophageal dilation. C. Fundoplication. D. Prokinetic agents. Answer. B. Esophageal dilation. Explanation: the patient's symptoms and endoscopic findings are consistent with an esophageal stricture, likely caused by GERD. Esophageal dilation is the appropriate treatment to relieve dysphagia and improve the passage of solid foods through the narrowed area. Question 3. A 70-year-old male with a history of smoking presents with hemoptysis and weight loss. A chest X-ray reveals a mass in the right upper lobe. Biopsy confirms non-small cell lung carcinoma with mediastinal lymph node involvement. What is the most appropriate initial step in the management of this patient? A. Surgical resection of the lung mass. B. Radiation therapy to the mediastinal lymph nodes. C. Systemic chemotherapy. D. Biopsy of mediastinal lymph nodes for staging. Answer. D. Biopsy of mediastinal lymph nodes for staging. Explanation: before considering any definitive treatment, proper staging is crucial. Mediastinal lymph node involvement suggests advanced disease, and a biopsy of the affected lymph nodes is necessary to determine the extent of the cancer. Once staging is complete, appropriate treatment, such as systemic chemotherapy, radiation therapy, and possibly surgery, can be determined based on the stage of the disease. Question 4. A 45-year-old male presents with a painful, swollen, and erythematous right leg. He has a history of deep vein thrombosis, DVT, and is currently on anticoagulation therapy. Physical examination reveals a tender cord-like structure along the medial aspect of the right thigh. What is the most appropriate next step in management? A. Continue anticoagulation therapy as prescribed. B. Perform venous duplex ultrasound of the right leg. C. Start thrombolytic therapy immediately. D. Administer intravenous antibiotics. Answer. B. Perform venous duplex ultrasound of the right leg. Explanation: the patient's presentation, including the history of DVT, suggests the possibility of recurrent DVT or superimposed cellulitis. A venous duplex ultrasound can help confirm the presence of a thrombus and guide further management. Thrombolytic therapy is not the first-line treatment for DVT, and antibiotics should only be considered if there are signs of a superimposed infection. Question 5. A 30-year-old female presents with a painful, non-tender mass in the left breast. On examination, the mass is mobile, well circumscribed, and has a rubbery consistency. No axillary lymphadenopathy is noted. What is the most appropriate next step in management? A. Mammography. B. Fine needle aspiration biopsy. C. Excisional biopsy. D. Antibiotic therapy. Answer. B. Fine needle aspiration biopsy. Explanation: the patient's age and the characteristics of the breast mass are consistent with a fibroadenoma, which is a benign breast tumor commonly seen in young women. Fine needle aspiration biopsy can confirm the diagnosis and rule out other potential causes of breast masses. Question 6. A 60-year-old male with a history of alcohol abuse presents with hematemesis and melena. He is hypotensive and tachycardic. Initial resuscitation with intravenous fluids and blood transfusion is started. Which of the following is the most appropriate next step in management? A. Endoscopic variceal ligation. B. Intravenous proton pump inhibitors. C. Blood transfusion to maintain a hemoglobin level greater than 8 grams, DLD. Surgical exploration. Answer: A. Endoscopic variceal ligation. Explanation: the patient's presentation with hematemesis and melena is suggestive of upper gastrointestinal bleeding, likely from esophageal varices due to alcohol-related liver disease. Endoscopic variceal ligation is the first-line treatment to control bleeding and prevent further complications. Intravenous proton pump inhibitors can be added as adjunctive therapy, and maintaining a hemoglobin level greater than 8 grams per deciliter is important for hemodynamic stability. Surgical exploration is not the initial management for acute variceal bleeding.